How's it going, guys? Past level question, ECG, step 1, internal medicine 2CK. 6-year-old woman, asymptomatic, her ECG shown. Question wants to know what our diagnosis is and what the treatment is. Choices A and B, first degree heart block, wrong fucking answer. So if it's first degree, we're merely going to have a long PR interval greater than 200 milliseconds. I don't really know what to tell you. Okay, so the P wave that occurs before the QRS, you would just note that it looks extra long and the patient would be asymptomatic and you don't have to treat it. Okay, so the problem can be at the AV node. Wrong fucking answer. Choice B, Mobitz 1, wrong fucking answer. So we talked about the secondary heart blocks, Mobitz 1 and 2. Mobitz 1, aka Qbank. Okay, no idea why it has that name, but Mobitz 1 is when you have a gradually prolonging PR interval followed by a dropped QRS. Okay, so you'll just notice that, let's say they give you 6 QRS complexes and they're just, you can see one is clearly just not shown up. And you can see prior to that dropped QRS, the PR interval is gradually prolonging, and then you have the dropped QRS, as I just fucking said. You don't need to treat it for USMLE. Okay, so type first degree heart block and Mobitz 1, no treatment for USMLE. Wrong fucking answer. Mobitz 2, wrong fucking answer. So Mobitz 2, unlike Mobitz 1, you're not going to have a gradually prolonging PR interval followed by the dropped QRS, okay? So you'll just have a random dropping of the QRS complex. Sometimes there can be a pattern to it. It can occur every 2, every 3. Okay, you can have a 2-to-1, 3-to-1 type of pattern. But on one of the newer NBMEs for step 2, I've actually seen 2 to 3-to-1 relationships for Mobitz. This is a Mobitz 1 question. The point is, Mobitz 1, gradually prolonging PR interval followed by the dropped QRS. Mobitz 2, you do not have a gradually prolonging PR interval. You just get a random dropping of the QRS. It's dangerous. Okay, there's a high probability of descending into third degree. So they want pacemaker for USMLE. Mobitz 2, wrong fucking answer. Third degree, correct answer. Okay, so here on the ECG, you see a super slow heart rate. So the QRSs, there's 2 things you're gonna be looking for, okay, on the ECG. Number 1, super slow heart rate where 7, 8 boxes, large boxes apart. So you're gonna be seeing the ventricular escape rhythm, okay? It's a heart rate of 30 to 40. So you'll get the ECG strip and you say, I suck at ECGs, but I just say, hold on a second. You see how the QRSs are super far apart? Okay, that's the first thing you notice for third degree. The second thing you notice is that there's no relationship between the P waves and the QRS complexes. It's QRS on the left here. Doesn't look like the P wave is before it. I mean, you just don't see it there. And then the second one, it's well before it. The third one, it's right before it. So there's no relationship. And this is because you have a complete severance of electrical signal from the supraventricular domain down to the ventricular domain at the AV node, okay? So Mobitz 2, I mean, you can have His-Purkinje fiber malfunction. We said first degree Mobitz 1 is AV node, Mobitz 2, His-Purkinje. Third degree can technically be AV node or His-Purkinje. USMLE really doesn't give a fuck. Okay, I'm just elaborating for some of you who want some context. So they want pacemaker for USMLE. You need to know that pacemaker is going to be for Mobitz 2 and third degree. Flecainide just threw in randomly to be a fucking asshole. Okay, flecainide is a type 1C sodium channel blocker. That's first line rhythm control for atrial fibrillation patients who have no structural or coronary artery disease. So let's just hop to the final ones. Wolff, Parkinson, White, wrong fucking answer. So procainide can be a treatment for that. Wolff, Parkinson, White is just a reentrant tachycardia variant. And you can get a delta wave, OMG. Okay, it's a slurred upstroke of the QRS. Mostly garbage. Wrong fucking answer. You know the deal. I'm going to make more content like my stuff, Scrum channel. Appreciate your time. That's it.